tennis from rooftops
Yes.
of their terraces. So it was a beautiful,
Yeah.
beautiful story. There are some questions coming as well about the effects of this pandemic on young people. Besides mental health and anxiety, what are the other consequences that we can notice on young people?
So the first thing is that all people can be infected with this virus. We know that, whatever age group they are. What the data is telling us so far is that the majority of younger people who are infected tend to have a more mild disease. But that's not always the case. So we do know that young people and children can develop severe disease, and we do know that some young people, some children die. And so it isn't universal. We are not invincible to this. Young people are not invincible to this. The other thing is that if you are infected, no matter what age you are, you can pass it to somebody else. So not only is it important to prevent yourself from getting infected and developing a disease, but you have a responsibility and some power here to prevent infecting somebody else. And you could prevent infecting somebody else who's part of a vulnerable group who are at a higher risk of developing severe disease and death. We're learning quite a lot about what mild disease means and what mild disease looks like, and the recovery of some people. We're starting to learn that there are some individuals who, even though they had what would be considered a mild disease and not really needing hospitalization, are having some long-term effects of difficulty breathing. They're not able to get back up to exercising the way that they would like. They're having fatigue. We don't completely know the disease profile yet. I know this pandemic feels like we've been in it for an incredibly long time, but it's still new, and we're still learning it all the time. So it is important that you do everything you can to protect yourself, but do what you can to protect your mom and your grandma and your aunts and your loved ones, because it is a responsibility that all of us have. And again, we just want everyone, and especially young people, to feel empowered. You have control, you have hope, there's a lot that you can do. There's a lot that we can all do.
Thank you, Maria. There are, besides effects that are happening now with the virus affecting all of us, including young people, there are some also long-term effects in terms of education and job opportunities. Can we comment on this as well?
Yeah.
I think this has been the greatest shutdown in education in history, in terms of days and hours lost in formal education. And it's a great credit to the schools and the teachers and the students who've managed to keep going with virtual education, but that has not been possible for everyone. So clearly there's a lot of catching up to do on the education side. That's for sure. And again, the economic losses will go on in the sense that there will be an after effect. And it's tough enough. I mean, if I'm a young person now coming out of college, it's already tough enough to get a job, get an internship, no job, no experience, no job. So even getting experience when everything is shut down. So it is an extra worry, and things are going to recover. We hope they'll recover more quickly than slowly, but it's an extra strain on particularly on younger people, because while our lives, I think, over the last half century have become in general more prosperous, they've become more uncertain in that sense. There's no guarantee of a job, there's no guarantee of an income. It's the top 1% may live in luxury, but for most ordinary people, it's about getting a job, getting on in life, and there is that degree of uncertainty, and there are no jobs for life. So there's a lot of uncertainties out there, but and COVID and the disruption that COVID has caused is a negative thing. On the positive side, I think there's great hope. I don't know, maybe I'm wrong, but I sense a new energy for a different way of living. And I think this is where young people really have the power to change things. Is this the world we want? We want a world where we're constantly worried about jobs, worried about our incomes, worried about paying our debts, constantly trying to gather wealth, constantly trying to get into that top 1% while many others fall into poverty. A world in which we exploit the planet, we exploit other human beings in order to get ahead, and to use that terrible term. Or do we see a future that's a bit more balanced, where life and love and community are a bit more balanced, where our relationship with nature and the planet is a bit more sustainable, and where we don't have to strive so hard for attainment and wealth, but where we can learn and grow more together as a society. And I get a sense, maybe, as I said, maybe I'm wrong, but I get a sense that young people don't want the world we're giving them. They want something different, and I think they want something a whole lot better. And I wish to God we could give it to them, but I think maybe the young people are going to have to take it themselves and demand. And this is where I think, young people and youth are not helpless. You need to get political. You need to get out there. You need to stop looking at the world of politics as the world of adults and start learning that the world of activism and politics is your world, and that will define the future. And we need young leaders to step forward and represent you and represent the future, because I'm not without hope. I think we're going through a tough time, but sometimes in the darkest of times is when we see the light, huh? So hopefully, inshallah, we will find a better way.
Yeah, Alex, sorry, just to say one thing, there was the Director General held a webinar today with youth, and one of the things he said, touching on what Mike just said, was we need to give young people a larger role in political decision making. And more than half of the world's population, please use that voice, use it wisely. And
Has shown lesser cases in the nations who made good progress.
why does it keep resurging?
Yes.
So that's a very good question. So what you're referring to, and thank you for this question, is that this virus is still circulating in many countries. And what we have outlined as the World Health Organization are the actions that need to be taken to bring transmission under control. We call this breaking chains of transmission. We don't allow the virus to pass between people. And there's a number of actions that many, many countries are doing, and they're being successful at that. If the virus has an opportunity to interact with people in these crowded spaces, for example, the virus will resurge. If we allow this virus to circulate, it will. So there's a lot of things that governments need to do, that communities need to do, that individuals need to do to be ready and to act very quickly when the virus is identified, so that we could break
In WHO programs.
Lots of ways. Yes, we have volunteer programs, we have internship programs, we have a junior professional program with many different countries like Korea, Japan, I think, Netherlands, and a few others. So there are arrangements with certain countries where we have a formal junior professional. The internship program was wide open, and in fact Dr. Tedros, which I thought was a great initiative, because coming to Geneva as an intern may sound great until you see what it costs to live somewhere like this.
Yeah.
And for many years, interns could come, but they couldn't support themselves. So you can imagine the interns would have come from a different set of countries. And Dr. Tedros has instituted a system of subsidies so that interns can come from all over the world and experience time here. I don't know where the cycle of the program is now. And we have a WHO volunteer program. We love when people do pro bono work for us. We're very happy to work with people. We have a lot of people who work on $1 contracts. And, we also have 147 country offices, and certainly I'm sure they would always like assistance. So yes, we could look at pointing people in the direction. And there are other volunteer programs. UNICEF is a volunteer program, Red Cross is a volunteer program, so it doesn't have to be WHO. There are some brilliant NGOs out there. And remember, in your own places, in your own cities, you have NGO, non-government organizations and charities who work with homeless people, who work with people with mental health disorders, who work with older people, and get out there and volunteer and do something. There is nothing more gratifying than giving your time to a cause, and it pays back immeasurably. So, and if there are any budding stars out there, we can try and steal them for WHO. Huh?
I met one, and when I did the UNICEF, the world's largest lesson, who was telling us, thinking of ways to look forward and how is this pandemic going to change the way we do preparedness and how we look, and great ideas. But it's also a good idea. It's also a way to get experience. So I have a lot of people that come to me sometimes, especially interns, that come and say, how did you get the job you have, and what was your plan? a lot of the time to get started, it's hard to have that experience. So volunteering is a great way to get some experience and some practical experience and learn what you like, learn what you don't like. Learning what you don't like to do is also just as important as learning what you like, and meeting people and networking and meeting as many people as you can. So lots of opportunities to work with us and other agencies.
I would love to have an army of young people supporting us on social media, but I just want to mention that I've been with WHO over 5 years, and I started as an intern. And if I wasn't a student in Geneva already, it would be impossible. So
Yeah.
this is a great progress that I've seen as well since I've been here, that we have more people coming from developing countries to support us and to gain experience.
It's a confirmed case or a suspect case. It's important to stay apart. And it's important to stay apart for a certain amount of time, get themselves tested, make sure that if they know that they're infected or not. So our recommendation is if there is a case, that you isolate the case, that the case themselves is isolated. And if you are a contact of that case, then you become quarantined yourself. So any contact there is important not to have. But if no one is a contact, then there's ways that you could be safe with your partner. The normal ways to be safe with your partner.
Yeah, I think the risk here is not intimacy. The risk is proximity.
Yeah.
So if for the reasons of COVID you need to be far apart, then intimacy is not possible. And if it's okay to be close together, then have fun. I think it's a matter of being careful with respect to the health of others. And if the local rules are, and it's particularly true, I think, of people in younger relationships where they'll live at home and they meet outside. For people who live in apartments, if you're living with your partner, then you're either going to be quarantined or not, or you're going to be together or not. I think the tough thing has been in these lockdowns, boyfriends, girlfriends, boyfriends and boyfriends, girlfriends and girlfriends are sort of been stuck on different parts of a city for 15 weeks, and they can't go to each other's houses because of the rules, and that's been quite tough on people. So I think as things ease and people can move and meet in groups again, that's fine. So I think you really just have to follow the local rules. But as I say, it's not about intimacy, it's about proximity. If you shouldn't be close to someone, don't be close.
Thank you very much. I'm afraid that we're running out of time, that Dr. Mike needs to join another important commitment. We thank everyone for your...
Could I just, before you finish,
please,
just one thing, because I think it's important in terms of getting our messages right amongst ourselves. I think each and every young person needs to look at the different encounters they have, the frequency, the intensity and the duration. You get to choose at some level. You choose whether you go to the gym or not.